You think sleep is your friend. You think lying down at night, closing your eyes, and drifting off is the one time your body gets to rest and heal. But what if I told you that for millions of seniors, sleep is actually the most dangerous part of their day? What if I told you that the way you sleep right now could be silently damaging your heart more than smoking, more than junk food, more than stress? And the scariest part? You would never feel it happening, not until it is too late. This is Dr. Danzy, and welcome to Dr. Danzy Senior Health Tips. Before I reveal the shocking truth about how your sleep habits are harming your heart, let me tell you about a patient I will never forget. A 74-year-old man came to see me. He was proud of his health. He walked 2 miles every morning. He had never smoked. His cholesterol was fine. But he had one strange complaint. He said, "Dr. Danzy, I sleep 8 hours every night. I go to bed at 10. I wake up at 6. But I never feel rested. I wake up with a headache almost every morning, and sometimes my wife tells me I stop breathing in my sleep." He laughed when he said that. He thought it was just a quirk, a funny habit. He said, "Old people snore, right?" Here is where most people make a deadly mistake. They think snoring is harmless. They think waking up tired is just part of getting older. They think a morning headache is just dehydration or stress. That is a myth, a very dangerous myth. In fact, a study of over 1,800 seniors found that those who regularly woke up with headaches and loud, disruptive snoring were nearly 3 times more likely to have silent heart damage than those who slept quietly. 3 times. And yet, every single night, millions of people are doing exactly what my patient did, ignoring the warning signs, laughing off the symptoms, and all the while, their hearts are under attack. So let me explain what is really happening inside your body while you sleep. When you lie down, your throat muscles relax. For most people, that is fine, but for millions of seniors, those muscles relax too much. The soft tissue in the back of your throat collapses and blocks your airway. You stop breathing, not for minutes, for seconds, 10 seconds, 20 seconds, sometimes longer. Your brain realizes you are suffocating and jolts you awake just enough to gasp for air. You do not even remember it happening, but your heart remembers. Every single time you stop breathing, the oxygen level in your blood drops. Your heart panics. It starts beating faster and harder to push blood through your body. Your blood pressure spikes. Stress hormones flood your system. And you do this 30, 40, sometimes 100 times every single night. Now think about that for a moment. Your heart is supposed to rest while you sleep. Your blood pressure is supposed to drop by 10 to 20% overnight. That is called nocturnal dipping. It is when your cardiovascular system recovers from the day. But if you have undiagnosed sleep apnea, your blood pressure does not drop. It actually goes up. Your heart races all night long. You are essentially running a marathon in your sleep without knowing it. One of my patients wore a heart monitor for 24 hours. During the day, his heart rate was normal, around 70 beats per minute. But at night, while he was sleeping, his heart rate spiked to over 120 beats per minute repeatedly, dozens of times. His heart was working harder while he slept than while he walked. He had no idea. And this is where the story gets even more frightening. The damage does not stop at high blood pressure. Over time, those repeated oxygen drops cause inflammation inside your blood vessels. That inflammation makes your arteries stiff. It makes plaque build up faster. It makes that plaque more likely to crack and form a clot. A study of over 2,000 seniors followed for 8 years found that those with untreated severe sleep apnea had a 40% higher risk of heart attack and a 60% higher risk of stroke compared to those without sleep apnea, 40%. And most of those people had no idea their sleep was killing them. Let me give you a simple test you can do right now while you are watching Dr. Danzy Senior Health Tips. Ask yourself these 3 questions. First, does your partner or family member ever tell you that you snore loudly? Second, have you ever woken up gasping for air or choking? Third, do you wake up most mornings with a dry mouth, a sore throat, or a headache? If you answered yes to any of these, you are at risk. And here is what scares me the most. Most people who have sleep apnea do not snore loudly. They do not gasp. They have no idea anything is wrong. They just feel tired during the day. They think it is normal. They think everyone feels that way, and they never mention it to their doctor. So let me reveal the first 3 ways your sleep is harming your heart, even if you feel fine during the day. Number 1, fragmented sleep is raising your blood pressure all night long. Every time you stop breathing, your blood pressure surges. By morning, your pressure is already elevated before you even sit up in bed. One of my patients had perfect blood pressure readings at his doctor's office, but when he wore a 24-hour monitor, his nighttime pressures were dangerously high. His doctor had been treating him for the wrong problem. Number 2, low oxygen levels are damaging the lining of your arteries. That lining is called the endothelium. When it gets damaged, cholesterol and calcium stick to it like rust on a pipe. Over years, that rust turns into blockages. Number 3, the stress hormones released during those breathing pauses make your heart muscle work too hard. Over time, that extra work can lead to an irregular heartbeat called atrial fibrillation, and atrial fibrillation doubles your risk of stroke. I had a 69-year-old woman come to my office. She had been diagnosed with atrial fibrillation 6 months earlier. Her cardiologist put her on blood thinners, but she kept having episodes. She kept feeling her heart flutter at night. No one asked her about her sleep. I did. She told me her husband moved to another bedroom years ago because her snoring was so loud. She woke up tired every single day. A sleep study confirmed severe obstructive sleep apnea. We treated her apnea with a CPAP machine. Within 3 months, her atrial fibrillation episodes dropped by over 80%. Her heart was not broken. Her sleep was broken, and no one had connected the dots. Now I need you to do something for yourself and for the people who love you. If you are still watching, you are the kind of person who takes your health seriously, and that means you need to be subscribed to Dr. Danzy Senior Health Tips. Hit that subscribe button right now, turn on the notification bell. Because in part 2, I am going to reveal 4 more ways your sleep habits are destroying your heart, including one that has nothing to do with snoring or breathing, one that happens to people who sleep perfectly quietly. And trust me, what I am about to tell you next will change the way you think about your bedtime forever. Also, write in the comments below. Tell me your first name and where you are watching from. United States, Italy, Spain, Brazil, or anywhere else. And tell me one thing. Do you wake up tired? Do you snore? Have you ever been told you stop breathing at night? Write the word sleep in the comments. You might save someone else's life by making them realize they are not alone. Welcome back to Dr. Danzy Senior Health Tips. If you are watching this, you survived part 1, but your heart might not survive another night of dangerous sleep. And I am not saying that to scare you. I am saying it because I have held the hands of too many patients who thought their tiredness was just old age, who thought their snoring was just a joke, who went to bed one night and never woke up. So let me continue where we left off, and let me tell you about something that will shock you even more. Remember the 74-year-old man I told you about? The one who woke up with headaches every morning? He finally agreed to a sleep study. We hooked him up to monitors overnight. His brain waves, his breathing, his heart rate, his oxygen levels. The next morning I sat down with him and showed him the results. A normal person stops breathing maybe 5 times per hour. That is considered normal. He stopped breathing 62 times per hour. 62. His oxygen level dropped below 80%. Normal is above 95. His heart rate spiked to over 130 beats per minute multiple times. He looked at me and said, "Dr. Danzy, how am I still alive?" And I said, "That is exactly the question you should be asking." Here is where most people make a second deadly mistake. They think if they have sleep apnea, they will know it. They think they will feel themselves choking or gasping. That is a myth, a very dangerous myth. In fact, a study of over 1,500 seniors found that nearly 70% of those with moderate to severe sleep apnea had no idea they had it. None. They did not remember waking up. They did not remember gasping. They only knew they felt exhausted during the day. And they blamed everything else: their mattress, their age, their stress, their diet. Everything except the real killer hiding in their throat. So let me give you the next 4 ways your sleep is harming your heart. And pay close attention, because number 4 is the one most doctors never talk about. Danger sign number 4. Waking up to use the bathroom more than twice per night. Most people think this is a bladder problem. They think it is prostate issues or age. But here is what is really happening. When you stop breathing during sleep, your body goes into panic mode. Your heart releases a hormone called atrial natriuretic peptide. That hormone tells your kidneys to produce more urine, even if your bladder is empty, even if you stopped drinking water hours ago. Your body is literally making urine while you sleep because your heart is in distress. One of my patients, a 71-year-old man, was waking up 6 times every night to urinate. He saw a urologist. He took medications. Nothing helped. I asked him one question. Do you snore? His wife burst out laughing. She said, he shakes the whole house. A sleep study confirmed severe apnea. After 3 weeks on CPAP, he started waking up only once per night. His heart stopped screaming, so his kidneys stopped flooding his bladder. Danger sign number 5. This one is very strange. Nighttime heartburn or acid reflux that wakes you up. You might think it is spicy food. You might think it is eating too late. But here's the truth. When you stop breathing, your chest pressure drops. That negative pressure literally sucks stomach acid up into your esophagus. It is not the food. It is not the timing. It is the fact that you are suffocating in your sleep. A study of over 800 seniors with reflux found that those who had nighttime symptoms were 3 times more likely to have undiagnosed sleep apnea than those with daytime reflux only. One of my patients had been on acid reflux medication for 10 years. 10 years. He slept on a wedge pillow. He stopped eating after 6 p.m. Nothing worked. We treated his sleep apnea. His reflux disappeared in 2 weeks. He was treating the wrong problem for a decade. Danger sign number 6. This one is for anyone who has high blood pressure that will not come down no matter how many medications you take. Resistant hypertension. That is the medical term. You are on 2, 3, sometimes 4 blood pressure pills. Your numbers are still high, especially in the morning, especially when you first wake up. Here is what most doctors miss. If you have untreated sleep apnea, your blood pressure cannot drop at night. Your blood vessels are constantly squeezed by those stress hormones. By morning, your pressure is already elevated. You take your pill. It helps a little. But by the next night, the same thing happens again. A major study found that over 80% of patients with resistant hypertension also had obstructive sleep apnea. 80%. One of my patients was on 4 blood pressure medications. 4. His pressure was still 160/90. A sleep study showed severe apnea. We started CPAP. Within 6 months, he came off 2 of the 4 medications. His pressure normalized, his heart was not broken, his sleep was broken. Danger sign number 7. This is the most surprising one. Depression, not just feeling sad. Clinical depression, loss of interest in things you used to love, feeling hopeless, feeling exhausted all the time. Here is the connection. The same oxygen drops that damage your heart also damage your brain. Your brain cells need oxygen to make serotonin and dopamine. Those are the chemicals that make you feel happy and motivated. When your oxygen drops hundreds of times per night, your brain cannot make enough of those chemicals. You wake up depressed, not because of your life, because of your sleep. A study of over 1,000 seniors with depression found that nearly half had undiagnosed sleep apnea. And here is the most important part. When they treated the sleep apnea, the depression improved in most patients without adding any antidepressant medication. One of my patients, a 68-year-old woman, had been on antidepressants for 5 years. She still felt terrible. She still had no energy. I asked about her sleep. Her daughter said, "Mom sounds like a chainsaw every night." A sleep study showed severe apnea. After 3 months on treatment, she told me, "Dr. Danzy, I feel like I woke up from a 5-year fog." She was not depressed. She was suffocating. Now let me address the myth that keeps people away from getting help. The myth is that CPAP machines are horrible. They are loud. They are uncomfortable. They make you feel claustrophobic. People say, "I tried it for 1 night and I could not sleep." I hear this every single day. And here is the reality. Modern CPAP machines are almost silent. They have heated humidifiers. They have masks that are soft and lightweight. And yes, there is an adjustment period. But a study of over 2,000 seniors found that after 30 days of consistent use, nearly 90% reported better sleep, more energy, and fewer morning headaches. The problem is not the machine. The problem is people give up after one bad night. They treat sleep apnea like a choice. It is not a choice. It is a heart disease risk factor as serious as smoking. Before I move to part 3, I need you to do something. If you have not subscribed to Dr. Danzy Senior Health Tips, do it right now. Hit that like button and write in the comments your first name, your country, United States, Italy, Spain, Brazil, or anywhere else. And tell me one thing. How many times do you wake up at night? To use the bathroom? To cough? Gasping? Write the number. Write the word apnea. Write, I will test my sleep. Because in part 3, I am going to tell you the single most dangerous sleep position for your heart. The one that even people without sleep apnea need to avoid. And I am going to give you 3 simple tests you can do at home tonight to find out if your sleep is killing you. No machines, no doctors, just you and your bedroom. And trust me, what I am about to reveal in part 3 will shock you more than anything so far.